locaux essentiellement, c'est-à-dire des ONG nationales. Et ce qu'il faut savoir, c'est qu'il y a des similarités, comme je l'ai dit le matin, dans ces trois pays, et plus spécifiquement une instabilité politico-sécuritaire qui a été là pendant très longtemps. Je pense que vous avez entendu parler de tout ce qui se passe à l'est de la RDC, des problèmes, que ce soit des conflits électoraux ou autres ici au Burundi, du génocide au Rwanda. Tout ça, ça s'est passé durant les 30 dernières années. Et nous avons aussi quand même, il faut le reconnaître, plusieurs avancées des femmes, un agenda des femmes, surtout au Rwanda. Et ça, c'est quand même assez intéressant, même s'il y a encore des gaps. Il y a aussi des services qui sont offerts, mais ce sont surtout des services qui sont très focalisés sur l'individu. Je dois aussi dire que il y a un tabou généralisé sur la question de l'homosexualité et très peu d'informations ou vraiment des actions affirmatives en lien avec les questions de LGBTQI. Voilà un petit peu rapidement pour le contexte. Alors, combien d'hommes est-ce qu'on a travaillé avec? Pour dire vrai, c'est très difficile avec un nombre presque plus de 20 partenaires de mise en œuvre. Il est très difficile de savoir combien d'hommes ont été survivants de violences et plus particulièrement des violences sexuelles. Nous avons un chiffre
من
approximatif entre
الرجال
1,3
الناجون منها
à environ 15%.
الأم.
Voilà. On peut passer la slide suivante, oui. Voilà, donc il y a environ 1,3 à 15%, dépendant des partenaires des mises en œuvre. Ceux qui ont un centre de prise en charge, comme ici au Burundi ou bien en RDC, reçoivent beaucoup plus de personnes que les partenaires qui travaillent directement dans la communauté sans vraiment avoir des activités spécifiques qui touchent les hommes. Alors, d'où viennent ces survivants? Souvent, ils sont amenés par les familles parce que la majorité d'entre eux sont des enfants. Il faut le dire, la majorité de ces bénéficiaires sont des enfants, même s'il y a aussi d'autres hommes, des hommes adultes. Et donc, ce sont les mères qui, les premières remarquent qu'il se passe quelque chose, elles viennent dans les centres et commencent à travailler avec des psychologues ou leur expliquent le problème par rapport à leurs enfants. Il y a aussi beaucoup d'hommes qui viennent pour chercher de l'aide par rapport à d'autres problématiques qu'ils ont, surtout des problèmes, des conflits avec leur conjointe. Ça arrive aussi. Et ce qu'il faut savoir, c'est qu'il n'y a que très peu d'hommes qui dénoncent les violences parce qu'ils ont peur d'être stigmatisés ou d'être labellisés comme des personnes qui ont perdu leur virilité ou bien qui ne sont plus forts, des personnes sur qui on ne peut plus compter, ou alors qu'ils ne sont plus considérés comme chefs et pères de famille. Voilà un peu ce qui se passe avec les chiffres et comment ces personnes viennent dans les centres ou bien chercher des services. Alors, lorsqu'on parle avec ces bénéficiaires, prochaine diapo, on, comment est-ce que les partenaires de mise en œuvre ou bien les hommes eux-mêmes expliquent la violence sexuelle qui leur arrive? D'abord, nous sommes dans des situations de guerre ou de conflits armés et ce sont des moments malheureusement propices où il y a vraiment beaucoup d'atrocités qui sont commises. Il y en a aussi qui s'expliquent par le fait que nous sommes dans une situation de fragilité de l'autorité de l'État et parce qu'on veut leur voler leur héritage ou bien on veut leur faire du mal, eh bien, ces personnes sont agressées. On parle aussi d'ignorance. Il y en a qui ne savent pas vraiment identifier le problème et disent, je ne suis même pas sûr que j'ai été survivant de violences sexuelles. Ça arrive aussi. Alors, beaucoup des jeunes hommes qui cherchent du travail sont aussi agressés et ils expliquent que c'est la pauvreté qui est à la base qui est comme facteur de cette violence. Il y en a aussi qui sont dans des situations délicates sous l'influence de l'alcool ou de la drogue, soit elles-mêmes en tant que survivants, soit les personnes qui les ont agressées. Il y en a aussi qui expliquent comme des représailles ou de la revanche, et d'autres parlent aussi de la solitude lorsqu'ils sont seuls, en situation pendant les voyages, pendant des cheminements, en situation de déplacement, parfois aussi à la maison lorsqu'ils sont seuls. Et il y a quand même pas mal aussi d'actes de violence qui sont commis en situation de détention. Il y a aussi, surtout lorsque les cas touchent les petits-enfants, les petits garçons de moins de 10 ans, on a l'impression que c'est aussi une irresponsabilité, je dirais peut-être pas ces mots, mais en tout cas une ignorance des parents en lien avec les besoins de protection des petits garçons, parce qu'il y a beaucoup plus de focalisation sur la petite fille ou la jeune fille et très peu de mécanismes de protection qui sont mis en place pour protéger les garçons ou les petits garçons. Voilà un petit peu de notre expérience du projet, ce qu'on peut dire par rapport aux facteurs. Alors, quelles sont les violences que subissent les hommes? Les viols, bien sûr, mais aussi la torture sur les organes sexuels. Alors, euh, il y a aussi l'humiliation publique pour faire des actions sexuelles devant les gens, la masturbation devant les gens, des actes très humiliants, qu'on déshabille les personnes et tout ça. Il y a les mariages forcés. Il y a aussi les attouchements, les voyeurismes. Comme je l'ai dit, les jeunes garçons sont vraiment affectés. Ce sont eux d'ailleurs, la plupart des cas qui sont amenés ou bien qui viennent, ce sont des très jeunes gens. Et ça se passe surtout dans ces circonstances où il n'y a pas de respect de la personne humaine, où il y a besoin de rabaisser un groupe représenté par cet homme, surtout dans les situations de conflit. Et on a aussi pensé qu'il peut y avoir, ce n'est pas très fréquent, mais il peut y avoir des personnes qui ont des pulsions homosexuelles et qui, par abus de pouvoir, préfèrent abuser des jeunes gens au lieu d'avoir une relation consentie avec des personnes adultes. Alors, on peut aussi dire que dans des situations, des conflits familiaux, certaines femmes peuvent aussi être des autrices des violences sexuelles, euh, notamment les nounous, des jeunes garçons qui vont se donner à des attouchements auprès des jeunes garçons ou des femmes d'âge mûr qui vont avoir de l'exploitation ou de l'abus de pouvoir envers des jeunes gens qui travaillent pour elles, des questions comme ça. Après, on parle aussi il y a d'autres hommes qui ont rapporté d'autres cas qu'ils considèrent, eux, comme de la violence sexuelle, notamment des insultes sexuelles, de l'humiliation de la part de leur conjointe et tout ça. Alors, un point aussi important, c'est que beaucoup d'hommes ont rapporté euh, des cas où ils pensent être victimes de sorcellerie et ils considèrent l'impuissance sexuelle dû à ce qu'ils pensent être de la sorcellerie comme un cas de violence sexuelle. Voilà. Alors, qu'est-ce que nous faisons lorsque ces personnes viennent dans le programme? D'abord, il y a des centres de prise en charge. Les centres de prise en charge holistique, comme vous le savez, où on offre l'accompagnement médical, psychologique, parfois des actions de réintégration. Et cet accompagnement peut être fait individuellement ou bien des groupes de psychothérapie. Et là, nous travaillons avec des groupes thérapeutiques d'hommes où il y a un groupe d'hommes qui ont les mêmes besoins ou les mêmes problèmes. On a aussi des activités pour élever le niveau de vie, donc les activités génératrices de revenus. Et beaucoup d'hommes demandent aussi un soutien spirituel dépendant de la religion d'où ils viennent. Après, il y a aussi des situations où il y a de besoin d'établir un dialogue entre les conjoints lorsque le survivant présente son cas comme étant une violence sexuelle ou bien une violence basée sur le genre commise par sa conjointe. Donc, dans ces cas-là, on a besoin maintenant de se focaliser sur les questions de problèmes du couple. Ça arrive aussi. Alors, il y a quand même quelques particularités, hein. Lorsque on travaille avec les hommes, donc je suis en train de vous parler de l'expérience des partenaires de mise en œuvre. Ils ont eu l'impression que comparativement au temps qu'il faut pour travailler avec les femmes, il y a beaucoup plus de temps qui est demandé pour travailler avec les hommes. Et les hommes préfèrent une prise en charge ailleurs que dans les centres réguliers de prise en charge. Ils sont un petit peu plus exigeants en termes de confidentialité et donc, même pour être à l'aise, ils préfèrent vraiment d'autres espaces, pas directement dans les centres. Il s'adresse toujours, presque systématiquement, aux hommes prestataires de services. C'est très, très rare qu'ils commencent par s'adresser aux femmes. Et parler de leur histoire est très difficile. Ils préfèrent se concentrer sur le problème qui est survenu que d'expliquer vraiment dans quelles circonstances le problème est survenu parce que ça renforce leur faiblesse dans des contextes où on attend des hommes un comportement de forts, des héros, des guerriers. Alors, les partenaires de mise en œuvre ou les prestataires de services ont remarqué que les survivants qui viennent veulent être guéris comme si c'était une maladie et demandent vraiment d'être guéris rapidement, que leur angoisse se termine, que leur honte se termine et tout ça. Donc, ils ne sont pas très patients et ils ont besoin de beaucoup de temps et de beaucoup de méthodologies pour établir vraiment une relation de confiance. Donc, ça pose beaucoup de problèmes et beaucoup ont directement des solutions, c'est-à-dire même s'ils savent que ça n'a pas marché, mais ils viennent avec des solutions appropriées à leurs problèmes en pensant qu'ils sont appropriés, mais souvent il faut négocier avec eux pour comprendre que cette solution immédiate ne peut pas résoudre tous les problèmes. Alors, les partenaires de mise en œuvre ont bien spécifié qu'il est très possible que la majorité des survivants ne se présentent pas dans le centre de prise en charge. Alors, on a beaucoup de défis, hein. On a beaucoup de défis dans la prise en charge. Et les premiers défis, c'est d'abord les stéréotypes. Les stéréotypes et normes sociales, notamment les attentes à l'égard de la masculinité. Étant donné que l'on attend des hommes qu'ils soient des personnes fortes, respectées, des personnes sans peur, eh bien, montrer de la honte, de l'humiliation, c'est vraiment très difficile pour eux. Et comme ils vont se retrouver dans une situation, ils doivent raconter ce qui leur est arrivé, parler de ce moment qu'ils considèrent comme de la faiblesse, c'est très difficile pour eux d'en parler. Et donc, tant qu'il y a ces normes-là, tant qu'il y a aussi un tabou à l'égard des autres types de masculinité, les hommes ne viennent pas. Donc, les stéréotypes sont vraiment une barrière, un frein à ce que les hommes survivants viennent chercher de l'aide. Autre chose, c'est qu'il y a très peu de confiance que les survivants placent d'emblée dans les prestataires des services, surtout les femmes. Ils sont conscients, selon leur dire, que souvent c'est l'homme qui est considéré comme un auteur de violence. Alors, pour ceux qui viennent parce qu'il y a eu une situation, ils ont été agressés, que ce soit par un homme ou pire encore par une femme, quand ça arrive, ça devient encore plus difficile de faire confiance aux prestataires que ces prestataires vont le croire. Donc, ils ont des doutes qu'on ne va pas les croire et ils ne viennent pas. Ou alors, ils viennent trop tard. Il y a aussi le système de prise en charge qui n'est pas adapté. Je remercie vraiment la précédente présentatrice qui nous a donné quelques directives. Ça, c'est très intéressant. Mais pour l'instant, la prise en charge est vraiment concentrée sur les femmes. Le système de prise en charge, les mécanismes, la manière dont on offre ces services est très concentré sur les femmes. Même les ordinogrammes, les guidelines et tout ça, souvent le survivant est une survivante. Voilà. Et donc, les prestataires aussi qui offrent des soins pour la prise en charge sont souvent féminins. Et autre chose, c'est que ces prestataires n'ont pas souvent toutes les formations nécessaires pour adresser les questions des hommes. Même dans la société, même dans les activités de sensibilisation, on est tout le temps en train de parler de survivants au féminin, ce qui fait que les hommes qui sont survivants ne se retrouvent pas dans ces systèmes de prise en charge. Après, il y a cette crainte vraiment qui bloque, c'est que les gens ont peur, les hommes ont peur d'être catalogué comme un homosexuel. C'est-à-dire que même s'il sait qu'il n'a pas voulu cette relation forcée, le fait de dire qu'il a subi une agression sexuelle, pire encore un viol, eh bien, il a peur, la plupart des participants ont dit qu'ils ont peur d'être labellisés comme gays. Après, il y en a beaucoup qui craignent les représailles. Nous sommes quand même dans une situation, parfois dans certaines zones d'intervention, de conflits armés, où il y a encore des bandes armées. Lorsqu'on parle de ce qui s'est passé, on risque des représailles. Et il y en a aussi qui craignent des représailles par des forces de sorcellerie ou bien spirituelles. C'est-à-dire que les questions de sexualité dans les zones d'intervention sont considérées aussi comme il y a dedans un lien spirituel avec la personne avec qui on a eu un rapport sexuel, consenti ou pas. Et ça, c'est le problème, c'est y compris pour les femmes. Donc, il y a beaucoup de croyances là-dessus. Si on a eu un rapport sexuel consenti ou pas avec quelqu'un, il y a un lien spirituel. Et donc, cette personne a un pouvoir sur la survivante ou le survivant. Alors, les hommes n'en parlent pas parce qu'ils craignent ces liens spirituels-là que la personne peut faire aussi des représailles. Voilà, c'est un petit peu ça les défis. Et ce que je peux conclure de ma présentation, c'est que les violences faites aux hommes existent, mais elles sont tabouisées et se commettent sur une base de déséquilibre de pouvoir. Ça, il faut le savoir. C'est très difficile à combattre à cause des stéréotypes de genre et du poids du patriarcat. Ça, c'est très important. Donc, il ne faut pas seulement penser que ce système patriarcal est seulement oppressif sur les femmes, mais il est aussi oppressif sur les hommes et surtout sur certains hommes qui ne sont pas catalogués comme les hommes qu'il faut, c'est-à-dire cette question de masculinité hégémonique. Il faut savoir que travailler avec les survivants hommes requiert des stratégies, des compétences et même des actions additionnelles que celles qu'on a l'habitude d'avoir lorsqu'on travaille avec des femmes. Donc, les acteurs, nous devons rester vigilants et renforcer nos capacités d'offre des services et pourquoi pas adopter même les méthodes de sensibilisation. Il faut aussi, à mon avis, des études fouillées. Je sais que dans des situations de contexte humanitaire, c'est très difficile de mener des études, mais on doit quand même avoir des informations très importantes, très ciblées, pour savoir quels sont les types de violences qui sont malheureusement courantes dans ces milieux. Donc, les connaissances actuelles sur cette question vont permettre d'adapter les stratégies de sensibilisation, de conscientisation et même les moyens de prise en charge. Après, il faut aussi savoir que les garçons, surtout les jeunes garçons, requièrent une forme de protection aussi contre les violences sexuelles. Ce ne sont pas seulement les petites filles qui sont malheureusement ciblées par des prédateurs sexuels, mais aussi des petits garçons. Et ça, nous avons malheureusement l'impression que ce n'est pas suffisamment pris en compte, que ce soit par les acteurs d'offres de services, mais même par les familles et les communautés. Voilà ce que je peux rapidement dire par rapport à ça. Merci.
Thank you so much, Dr. Aziza, for that presentation. I know there are several things that we can take note of in that presentation. I hope that people have questions. If you have any questions, you can just raise up your hand. But there are a few things that I noted from that presentation. We know that there's forced marriages for young girls, but now we are being reminded that it's the same for boys as well. The minors. Hello, you can't hear me? Can everyone hear me? Okay. Yes, so we know that there's forced marriages for girls, isn't it? Because we've been trying to end early marriages for... Okay, sorry. Yeah, we know that there's forced marriages for girls, but now we notice that even for boys it's the same. We also know that young girls are more affected, but now it's coming out that even minors, the boys, are also affected. I know that some people may not understand this witchcraft, but I think in this part of the world, we understand that there's witchcraft and somebody can actually be bewitched and then they don't perform sexually. So that's one of the things that has come out of her presentation. And also there's violence against men perpetuated by women. I think we need to take note of that. There's a component that I wasn't sure of when you talked about spiritual support. Maybe just in one or two sentences, you can clarify what that is. But we also take note of the challenges that we have in addressing survivors related to men, and that they're impatient, they want to get well very fast, they want to deal with it on their own, it's difficult for them to talk. So those are the things that I noted from the presentation. Maybe before you just answer my question, you can add a few others. There's one that the question that has come from Pamela. I don't know if she wants to say it herself, but there's a question in the chat that she has raised. I know you've tried to address it, but maybe you can say something about it. Are there any other questions that I have missed out apart from the one from Pamela? Okay, you can just talk about those two issues. There's a spiritual support that you mentioned, and also the question from Pamela. Maybe you can address it, before any other questions come up.
D'accord. Merci beaucoup. Alors, d'abord pour la question du soutien spirituel, hein. La question du soutien spirituel, c'est que la plupart d'hommes ou des garçons qui viennent et qui ont subi cette agression sexuelle, et nous sommes dans un milieu où on ne parle pas beaucoup des questions de relations sexuelles des hommes entre eux, donc ils ne comprennent pas qu'une telle chose leur soit arrivée. Ils considèrent qu'il s'est passé que cet acte un tel contact spirituel, un tel contact physique a forcément un lien spirituel. C'est-à-dire que l'agresseur a comme une emprise sur le survivant. Et souvent, certains survivants vont percevoir ça comme une malédiction, d'avoir été pénétré ainsi ou d'avoir eu des attouchements avec un autre homme. Ils vont percevoir ça comme une malédiction, comme quelque chose de très nocif sur le plan spirituel. Et ceux qui sont croyants vont demander un soutien spirituel. Souvent, ce sont des personnes qui ont une foi dans une religion musulmane ou chrétienne, ou d'autres personnes qui croient en la religion traditionnelle africaine, c'est-à-dire qu'ils croient en la religion avec des liens avec leurs ancêtres et tout ça. Ils vont s'imaginer que c'est rompu. Et donc, nous avons aussi des cas, des personnes qui vont demander à être, entre guillemets, purifiées. Purifiées de manière religieuse ou purifiées par leur propre pratique. Alors, le programme, quand ces cas arrivent, on ne refuse pas. On peut les orienter vers la prise en charge spirituelle, c'est-à-dire vers les religieux avec qui travaille le centre, par exemple. Souvent, ce sont des prêtres ou des pasteurs qui vont aussi être intégrés dans la prise en charge. C'est un soutien très important qui est demandé par ces personnes et dont le programme ne peut pas fermer les yeux. Alors, c'est la même chose aussi pour cette question des sorcelleries. C'est-à-dire que le survivant, surtout ceux qui qui découvrent pour la première fois que des hommes peuvent avoir des relations sexuelles avec d'autres hommes, vont imaginer vraiment qu'ils sont ensorcelés, surtout si c'est une pratique qui va durer avec les petits garçons ou des garçons qui vont être abusés pendant longtemps. D'autres qui considèrent qu'ils vont avoir des problèmes d'érection, par exemple, qui ne vont plus être en mesure d'avoir maintenant des relations sexuelles saines de leur côté. Ils vont penser que cet acte qui leur est arrivé, c'était un acte de sorcellerie. Ou bien que des femmes les ont ensorcelés, ils vont considérer ça comme une violence sexuelle. Voilà un petit peu ça. Alors, la question d'Njoumé Pamela, j'ai essayé d'y répondre. Effectivement, il y a des hommes qui viennent et rapportent que les autrices des violences sont des femmes. Souvent, avec les petits garçons, il y a
Dr. Aziza. Hello. Maybe so that we don't waste a lot of time, maybe we can allow Miriam to make her point because I've noticed you've addressed Pamela's question in the chat. So when Miriam has made her presentation or has asked her question, you can address it, and then we move to the next presentation. We are running out of time. Miriam?
Yes, please.
Can you quickly make your contribution?
Yes, please. I wanted to weigh in on the issue, one of the conclusions, which is talking about the strategies for addressing SGBV among men. I think there is, just speaking from what she said, there's a need to like move away from to decolonize and you know, look out for strategies that really work, because on the ground sometimes it seems like we just looking at, okay, what is working for women, and the assumption is that the same will work for the men as well. But if we talk about spaces for women, can we also be able to talk about spaces for men where you know, men feel comfortable to talk about issues of SGBV, them to open up, to be able to share the inner feelings, and actually, you know, sure that they can be supported more effectively. I think probably it could be something that we can weigh in on, and not just to have the assumption that just because certain interventions are work women will also work for the men. Thank you very much.
Thank you so much, Miriam. I think that was a contribution, a very good one. We can't have an homogeneous approach to interventions under GBV. What works for women may not work for men. Thank you so much. At this point, I'll request my friend June, my co-facilitator, to come through and introduce the next presenter. Hi, June. Maybe she's not able to, but we have another presenter in this meeting. We are going to have we are going to look at. Hi, June.
Yes, I've been able to unmute myself.
Okay, please.
Thank you.
Please, you can go ahead. Thank you.
Thank you. Thank you, and good afternoon, everyone. As Marjorie mentioned, I'm June Munala, Senior GBV Officer at the UNHCR Regional Bureau for East Horn and Great Lakes region. So our next presentation is also quite interesting, and I'm really looking forward to hearing more. It's going to be on looking at conflict and sexual violence against men, and particularly listening to perspectives from South Sudanese men who have been living in some settlements in Uganda. This presentation will be provided by Dr. Tosin Olaluwoye, who is a Nigerian-born and trained medical doctor who has a great passion for health equity in humanitarian settings. So after practicing as a clinician in Nigeria, he proceeded to Deakin University in Australia, where he obtained a Master of Public Health degree, and he's in the process of finalizing his PhD thesis, which looks at this particular topic. Dr. Tosin currently works as a sessional academic in Deakin University, where he teaches epidemiology, biostatistics, and research literacy to both undergrad and postgrad students. And he's a certified research consultant and has worked in many places, including, of course, Deakin University and other private establishments. So without much ado, I give the floor to Dr. Deakin to take us through his presentation. Over to you, Dr. Tosin.
All right, thank you very much, June. Can everyone hear me? Just trying to confirm that I'm audible.
Yeah, we can hear you.
All right, good evening. My name is Tosin. Sorry, good evening, good morning, good afternoon, depending on the part of the world you're listening to me from. Very quickly, I will be sharing my experience with my PhD research on conflicts and sexual violence against men. And essentially, I will be looking at the perspectives of South Sudanese men. Let me just put this in slide form quickly. All right, I think that makes life easier for everyone. Yeah, including me especially. Okay, this is not sure how this is working. Sorry. Okay, so I usually like to start by sort of just putting this warning out there, because of the sensitive nature of this topic, that there is a possibility that as I describe events, people might get triggered and all of that. I really do hope that if anyone is in that situation, they seek sort of support. So it's what is this study about? I'm really going to try to be as quick as possible. So it was a study that explored the forms and the health consequences of conflict-related sexual violence perpetrated against South Sudanese men who were at the time living in two resettlement communities in Uganda as part of my PhD. Of course, I also explored some of the factors responsible for conflict-related sexual violence against men. Now, I've listened to very wonderful presentations, particularly from Anna and from Aziza this evening. They've been spectacular. All the presentations actually. A lot has been said from the practice perspective, but I'll be doing a lot more from the academic sort of angle to this. Now, a lot of researchers have studied, have written about conflict and sexual violence, particularly against men. A lot has been said from the legal perspective, the international relations, political economy, and the rest of this. So I decided to sort of set mine in the humanitarian public health space. And one of the things that my study really contributes was whilst there's been a lot published, a lot of these published articles have actually been from the perspective of maybe male survivors of sexual violence in peace times or female survivors of sexual violence, and things have been extrapolated, to sort of imply, like somebody mentioned in the last session, to imply some of the things that happen to men. But I decided that I really wanted to know exactly what the men think about their perspective, and I mean about their experience, about being able to describe what exactly happened to them, because I believe that it is not just enough to say that this is what we think happened to men. It is even more important for men to be able to say this is what actually happened to us, and this is how we interpret it. And when I say, I mean, I'm talking about male survivors of sexual violence here. And I'd like to put in this caveat that this presentation does not in any way, even in the slightest way, attempt to trivialize efforts to support female survivors of sexual violence. I still believe that female survivors of sexual violence are in the majority and they always need to be supported. Why did I feel this study is important? Multiple reports exist in history, both ancient and modern history, about conflicts and sexual violence against men, men experiencing sexual violence in conflict settings. And we also know that because of their experiences, men go through several health consequences, which I will talk about shortly. And I've come to, and I just believe that keeping quiet about this issue, trying to wish that the problem would just go away, will not solve the problem. So I decided to sort of, I just put myself in the space there and said, look, let's know what people are actually saying about their experience. Now, I do know that the WHO and some other organizations actually said that survivors of sexual violence should only be interviewed directly in exceptional cases. But I believe that trying to understand the exact picture, the way people actually feel about their experience, is one of those exceptions, and it was the reason I did this study. So this methodology, briefly, it was an exploratory sequential mixed method study, which essentially means that I did the qualitative component, and the qualitative component now informed to a large extent the quantitative component. But the participants in the two studies were primarily the male South Sudanese who had experienced sexual violence in conflict. And of course, I also spoke with a few humanitarian aid workers the perspectives from the humanitarian aid workers was quite valuable. But of course, the crux of this work actually was to know what the men think about their own experience. So I use the social construction of masculinity framework. And I should just mention that even though I can't go into the details of all of that because of time, I, as much as possible, try to maintain all ethical standards that I've come across. Basically, I will be sharing the findings in the next sort of slides. I just want to quickly say that everything I say here is basically based on what the participants of this study told me about their experience, one. And I also should mention that the results I will share here will just be a bit of a snippet of what of the sort of so many results. Of course, you can imagine have quite a big reservoir of results that I'll have to share. I'm actually in the process of developing a report, hopefully based on agreement when I was going to start the research, developing a report for UNHCR and any organization that is interested in Uganda, just to sort of provide a report for the thesis that I've done and hopefully be able to make some formal presentation at the end of it. Hopefully at that point, I'll be able to expatiate a lot about the results. So what did I find? Now, basically, we're able to base this. So these are the findings from the qualitative studies, which were actually in-depth, semi-structured interviews. We're able to classify the kinds of sexual violence that men reported that they experienced into two forms. Of course, this classification is based on literature. There were some that were perpetrated directly against the male survivor, and those were the ones that I described as direct forms of sexual violence. And it includes stripping a man naked, raping men, or maybe forcing some men to rape other people, and the rest of other that time will not permit me to read. And of course, the indirect forms of sexual violence, which of course basically is about perpetrating the sexual violence against somebody while forcing another person. So the person that is experiencing the sexual violence is the primary survivor, or in that case, victim of sexual violence. And again, I would emphasize at this point that I still believe that females are still the most prevalent forms, survivors of sexual violence, and we cannot take that issue with levity. But in some cases, some men were forced, sort of witness the rape of female family members, and caused a lot of troubles that I will talk about as I proceed with the presentation. So in terms of the prevalence, I have quite a number of graphs, but this is the one that I just thought I would pick to share. The most commonest that I saw was stripping a man naked. And I will mention some of the importance of some of these in some of the slides later, because I actually want to go towards the end of my slide and do the most of my talking. So that was the most commonest, the most prevalent form of sexual violence. Rape and attempted rape, a little bit over half of them, or about half of the men either said they were raped either anally, either through the anus, or there was a bit of an attempt at rape. And then the most common form of indirect sexual violence that I found was men being forced to witness rape against their female family members. I must say that I sort of asked this question in three settings. So I asked about their experience in conflict, in South, when they were in South Sudan. I asked about their experience during flights to Uganda, and I asked about their experience in the resettlement communities. Clearly, sexual violence was more in South Sudan, and of course, it just sort of tapers downward towards the resettlement community. The prevalence that I report here happens to be one of the highest that I've seen so far. Actually, a lot of some other scholars have reported prevalence of sexual violence, but what I have here is basically one of the highest. Although I've also had some other sort of higher prevalences, particularly in detention camps. I've seen prevalences up to about 80% in some detention camps. I think I can't remember the exact country now, but it was just one of those studies. So they're highest. So why did the men think they were actually sexually violated? And I should mention here that this is what the men said, what the survivors said. Now, the caveat here is that they may not exactly know why the perpetrators were sexually violating them. So there's a bit of a limitation with this, because this is what they feel. But in the actual sense, in some cases, the men were told why they were doing this to them. So for instance, they could say, we're doing the F word to you because we want to show you that you are not man enough. So some of them told me things like that, and it was bitter for them. Some of them talked about the fact that, perpetrators were telling them that they were doing this to them, because they've not had someone to have sex with in it. So they were just using that, of course, because of the moral holiday that was associated, often with conflict. They are able to sort of satisfy themselves sexually by exploiting these people. And of course, lack of money is just the other one I want to mention, which is the reason, and I think one of the presenters said this earlier, why people actually experience sexual violence, particularly in the resettlement community. So what are the health complications? I looked at four, sort of classified the health complications into four: physical health, sexual health, and of course the mental health and social effects. So these are some of the health complications. Because of time, I won't be able to run through everything. But of course, think of anal pain, think of anal bleeding, fecal incontinence. These are some of the things that the men complain about. As a matter of fact, I remember talking to one of them, and even while he was sitting, he was still having some sort of discomfort sitting to talk to me. And some of them, of course, have reduced libido, premature ejaculation, and some other sexual health problems. The mental health issues include anxiety, depression, PTSD, suicidal ideation, and the one that is often not talked about, maybe because people don't really classify it as a mental health issue, but that's the issue of homicide. So I met quite a lot of people that talked about wanting to take revenge, and it just almost felt like if care is not taken, we might as well have in our hands some form of disaster waiting to happen if these people are not supported. Because there's quite a number of people thinking. When I went to the resettlement, when I first got there, one of the aid workers told me that the rate of suicide recently has increased, even though we were not able to at that point associate it with sexual violence. We could also not rule out the fact that the experience of sexual violence might be one of those things causing this thing. So these are some of the reasons that I believe that male survivors of sexual violence need to be supported in the spirit of humanitarianism. So some of the social consequences, some of the things we've mentioned about earlier: shame, uncertainty about gender, and a very important one, marital problems. Some of them actually have marital problems, and I will talk about that in a bit. So in
Dr.
terms of
Tosin,
okay,
sorry, I'm sorry that I'm interrupting you, but I
that's
request
all right.
that you take like about 5 or so minutes so that we can have a bit of time for questions, and we have to go back to the plenary at 3:30. My apologies for stopping you.
That's okay. That's okay. I'll just try to run through the remaining. I have about 5 slides left. So I'll just quickly talk about the support-seeking attitude and behavior. I must say that of all the survivors that I found, only about 2 in 5 survivors have sought support for their experience. Now, while we might think that's okay, maybe a good number, good percentage, the reality is that a lot of them actually go to seek this support from either. I have a breakdown of where they seek support, but of course, time will not permit me to do all of that this evening. I keep saying this evening because it's night here. But a lot of them actually seek support from family members. They seek support from religious leaders. A few of them come to the NGOs, and a few of them go to the hospital. But that's that. So why were the people that were not seeking support? Why were they not seeking support? One of the reasons was shame, fear of being blamed. A lot of them feel, and of course, there are instances, not in this particular context, but there are instances where I read about this somewhere else actually, where people have gone to men have gone to seek support for sexual violence, and people have actually told them, "Oh, you were supposed to enjoy that." You can imagine how that makes the survivor of sexual violence feel. Of course, construction of masculinity is another thing. People basically feel like men should never be sexually. I remember somebody literally told me, one of the survivors told me that these things should not happen to a man. It can happen to a woman, but it should not happen to a man. And of course, I had to sort of let it all out. I threw caution in the wind. I had to stop him right there. And I said, look, sexual violence should never happen to anybody, whether a man or a woman. But this is sort of the belief that they have, the belief that, look, this thing should never happen to a man, and so a man should not go seek support for it. and the rest of them like that. So in some cases, so these are some of the intrinsic factors why men do not seek support. But in some cases, when men actually go out to seek support, they meet some structural issues that they've told me about. And some of those structural issues, of course, some of those things we mentioned, limited available support. Some of them also feel, and somebody that I interviewed from UNHCR actually told me this, that the services available at the moment appear to be too particularly female focused. And I must say that one of the things that sexual violence against men achieve is emasculation. The men feel emasculated by their experience, and in most, these are people that have a patriarchy, the belief that men do not, men should be strong and all of that. It's their nature, it's their culture, it's the way they are. Now getting them to access services in a place that has a potential to make them feel a little bit more emasculated, I mean, they feel is really not the best. I'll just try to run through the other slide because of time. I think I have about 2 minutes left, because I really wanted to sort of dwell on this recommendation. And some of the things that I recommend, I think it's important to have a broader definition of sexual violence. I must share this quick experience. There was this man that I spoke to, one of the survivors, because I'm sharing this because I was talking to some people about this, and they were saying stripping a man naked should not be classified as sexual violence. But I remember talking to this guy, and when he was talking to me about 5 years after his experience, he was still I could see him trying to cover his private area. Now, this man was not raped or anything. The only thing that happened to him was that he was stripped naked. But seeing him do that while he was describing his experience told me that this guy was going through some serious psychological issue that needs support. That thing happened to him like 5 years ago, but here he was still dealing with it. Okay, so I think it's important to consider, and the truth is, maybe I'll just quickly give another example. Someone told me about a man. All that happened to him was that, oh, well, I couldn't just say all. What happened to him was that he was forced to rape his own daughter. Yes, that is sexual violence against the daughter. The daughter needs to be supported. But this man basically committed suicide, and it was just a terrible situation. Not, I mean, you could say, oh, he wasn't raped or something like that. So I believe that, we need to look at a more, a broader definition. We also need to consider an holistic approach. And I think Aziza mentioned that earlier, for healthcare. So when I say that, I say we need to think of the possibility that, the different health consequences. So when somebody comes to, our clinics, particularly for the medical staff, and says that, says things that are sort of related to sexual violence, we can know that, okay, this person is having pain in the anus because they've been raped or something like that. We need to think of the possibility that this person might be living with depression. We just don't want to treat the pain and say, okay, just go, because the pain will go away, but the depression will probably kill the man faster than the pain. So we need to think about things like that, because of course it can commit suicide. I think we need to introduce supports that specifically target men, and this is especially based on what survivors have said. I also think we need to involve religious leaders. I think this is what maybe one of the things that Aziza might be referring to as spiritual support, because this is one of the things the men told me. I remember somebody literally told me that oh, I've spoken to my pastor, and I'm not trying to preach any religion here, but he just said, I've spoken to my pastor and now I don't feel like taking revenge anymore. So, and of course, as an African man myself, I know how much we value religion and the rest of them. So I would say that it's always important to involve religious leaders, because the truth is that these survivors believe in religious leaders way more than they believe in us, to a large extent. Of course, I also believe in keeping the men busy. I particularly also argue that perpetrators of sexual violence need to be supported. And I would say, obviously, I have quite a number of them. Some research still needs to be done to try to sort of understand more about sexual violence against men, and especially how to really further support survivors of sexual violence. This is just some of the images that I used. And on that note, I'll say thank you for listening. I'm sorry for taking another 2 extra minutes. Thank you.
Thank you so much, Dr. Tosin. That was so interesting. I wish we had more time. I know we have like 2 minutes before we go back and I hand over back to Marjorie. But I think what has struck me as I was listening to you was the linkages that we see between the two presentations, you validating some of the things that Dr. Aziza was talking about in terms of in practice, what actually happens. And I think your study really helps us understand more in terms of building the evidence base around hearing more of these male voices. As much as we keep on talking about women voices, I think what has clearly come out is that we need to bring this more out to the open so that we can program more and better in our responses towards addressing issues of sexual violence, especially regarding male survivors. There are two questions in the chat. Maybe you could quickly respond to them, but because they're very brief. From Magdalene Alum, she wanted to know which settlement this study was done and whether this has been published. And then I will hand over back to Marjorie to conclude this session. Back to you for a minute, Dr. Tosin, and then to Marjorie. Thank you.
Thank you for the question. Sorry, I thought I was going to mention the resettlement. It wasn't in Vepi and Rhino camp, Rhino resettlement community. Has it been published? Not yet. This part of the results have not been published. The only thing I've published from it is a methodology paper, because I basically describe my qualitative methodology and some of the ethical issues. But the findings itself, no, I have the first drafts of some part of it, but I've not published. I think that answers.
Thank you.
No,
Thank you so much. We can all go back to we can all go back to the plenary now. Thank you for the two presenters. This has been very interesting, and we noticed that there are synergies between the two. So we see the experience and the theory part merging together. This has been very interesting. Let's please go back to plenary now. And thank you, Dr. Aziza. Thank you, Tosin, for this meeting. And thank you, June, for co-facilitating with me. We can all go back to plenary now. Bye-bye.
Hello.